1 in 3 men with an enlarged prostate are silently carrying a bacterial infection, and most have no idea until it's too late. You think it's just aging, waking up to pee, weak flow, that constant pressure. But what if it's not just age? What if it's a hidden infection damaging your bladder, draining your energy, and creeping up toward your kidneys? This isn't just annoying, it's dangerous. And today, I'm going to show you how it happens and what to do before it gets worse. Because once you see how one tiny bacteria can cause so much chaos, you'll never ignore these symptoms again. If you're over 50 and you're waking up to pee, dealing with weak flow, or feeling that constant pressure in your lower abdomen, you might think, it's just part of getting older. But it might not be. I'm Dr. Max, board-certified urologist and men's health expert. And today, I'm breaking down what really causes those symptoms, how bacteria sneak into your urinary system, and what you can do right now to protect your prostate, your bladder, and your energy levels. Because here's the truth, most men don't even realize they're walking around with an infection. No pain, no fever, just bacteria quietly multiplying day after day until something breaks. Stick around, because in this video I'll show you why prostate size isn't the full story, how bacteria sneak in and where they go, red flag symptoms you should never ignore, and the real-life case of Tom, 62, who thought he was fine. I had one patient, Tom, 62, former gym teacher, pretty active, thought he was in decent shape. He came in saying, "Doc, I've been waking up to pee 2 or 3 times a night. Stream's weaker than it used to be, but it's probably just age, right?" We ran some basic tests, and what we found? A sneaky bacterial infection, hiding behind an enlarged prostate. No fever, no burning, no pain, but that bacteria was already damaging his bladder wall, increasing inflammation, and setting the stage for a potential kidney infection. This is way more common than you think. It all starts with something called BPH, benign prostatic hyperplasia. That's just the fancy term for prostate enlargement. By age 60, more than half of all men have it. By 80, over 80%. But here's what most men don't know. BPH doesn't just mess with your stream. It creates urinary stasis, meaning some urine gets left behind in the bladder every time you pee. That leftover, warm urine becomes a perfect breeding ground for bacteria. That's when bacteria like E. coli and Klebsiella sneak in, and boom, you've got a low-grade infection doing real damage. Studies show that up to 35% of men with BPH are dealing with some kind of urinary tract infection, whether they feel it or not. And if it's not caught, that infection can travel up the ureters and attack the kidneys, leading to hospitalization, sepsis, or long-term damage. Now here's the part most guys completely miss. These infections don't just sit there. They chip away at your health slowly, quietly. Let's talk about what's really happening inside your body when this infection sets in. First, your bladder wall takes a hit. The bacteria irritate and inflame it, making it more sensitive, less elastic, and worse at fully emptying. You feel like you have to go all the time, but barely anything comes out. Second, your energy levels start to drop. Even a low-grade infection triggers your immune system, like a smoldering fire your body is always trying to put out. That drains your energy, affects your mood, and can even mess with your sleep. Third, your immune system gets overworked. And when your body is constantly battling bacteria, it becomes more vulnerable to bigger threats, like kidney infections, chronic prostatitis, and even systemic inflammation that affects your heart and hormones. And the worst part? Most men have no clue this is happening until it's too late. So, what should you be watching for? Here are the early signs that most men ignore. You're getting up to pee more than twice a night. That's not just aging. It could be your bladder reacting to hidden inflammation or low-grade infection caused by an enlarged prostate. Your stream feels weak or hesitant. That's often the first sign your bladder is working harder than it should and could mean urine is backing up or not flowing freely due to inflammation, infection, or prostate pressure. Don't ignore it. It's your body whispering before it starts shouting. There's a dull ache in your lower belly or groin. That nagging ache might seem harmless, but it's often a sign of underlying inflammation or low-grade infection irritating your bladder or prostate. Especially when it lingers, it's your body's way of saying, something's off down here. Don't just power through it. get it checked. You finish peeing, but feel like you didn't fully empty. That unfinished feeling after you pee isn't just frustrating, it's a classic sign that your bladder isn't emptying properly. And that's often caused by either prostate pressure or inflammation from an underlying infection. When urine lingers, it raises your risk of bacterial growth, which can lead to even bigger problems like bladder damage or kidney strain. If this happens regularly, don't ignore it. It's your body waving a warning flag. You feel tired or foggy for no clear reason. That sluggish, foggy feeling you can't explain? It might not be burnout. It could be your immune system quietly fighting off a hidden infection. Low-grade urinary infections caused by prostate issues can smolder for weeks without major pain, slowly draining your energy, dulling your focus, and wrecking your mood. If you're always tired but your labs look normal, your urinary tract might be the missing puzzle piece. That drop in libido or performance. It's not always just getting older. Hidden infections tied to BPH can quietly disrupt your hormone balance, reduce blood flow, and put stress on your entire system, including your sexual health. So if things aren't working like they used to, and you can't figure out why, your prostate and urinary tract might be the real culprits. The good news? Once you catch the root cause, you can fix it. And that's exactly what we'll cover next. How to treat the infection. How to support your prostate long-term. And how to finally stop waking up 5 times a night just to pee. Alright, so you might be thinking, okay, Dr. Max, I've got the symptoms. Maybe I've got the infection. What do I do about it? Let's break it down. Step 1. Diagnose it properly. No guessing. You need a proper urinalysis and possibly a urine culture. These tests check for bacteria in your urine and help identify which type, so the right antibiotic can be used. Don't just take leftover antibiotics from your last sinus infection. That's how resistance builds. And that's a fast track to chronic prostatitis, which is much harder to treat. Step 2. Treat the infection fully. If your doctor confirms a bacterial UTI, they'll likely prescribe antibiotics for 7 to 14 days, sometimes longer if the infection has reached the prostate. But here's the trick. Prostate tissue is harder for antibiotics to reach, so incomplete treatment often leads to relapse. Finish the course. No skipping doses. No stopping early when you feel better. You need to kill the infection at its root. Step 3. Reduce stasis and support flow. Medications like alpha blockers, like tamsulosin, can help relax the prostate and bladder neck muscles, improving urine flow and reducing leftover urine, which lowers infection risk. In some cases, a drug like finasteride may be used to gradually shrink the prostate and reduce pressure over time. Step 4. Strengthen your bladder and prostate defenses. This is where lifestyle comes in, and it matters more than most men realize. Hydration. Sip water steadily throughout the day, not too much at once. Avoid bladder irritants. Caffeine, alcohol, spicy food, and artificial sweeteners can inflame the bladder lining. Pee when you need to. Don't hold it in too long. Don't rush through it. Fully empty. Train your pelvic floor. Strong muscles down there improve control and reduce pressure. But here's the thing, beating the infection is just the start. If you want lasting results, fewer bathroom trips, better sleep, more energy, your prostate needs long-term support. That's what we're diving into next. The best foods to calm inflammation and keep your prostate healthy, natural supplements that actually work, and which ones to skip. Simple daily habits that help you sleep through the night instead of waking up 5 times to pee. Stick around because this next part, it's how you stop the cycle and finally take control of your health for good. You've treated the infection. Flow's improving. Sleep is better. But here's the question. How do you keep it from coming back? Because the truth is, if your diet and habits stay the same, so will the risk. Let's start with food. The more anti-inflammatory your meals are, the better your prostate will function. That means cutting out the junk, sugar, processed meats, fried foods, and leaning into what actually helps. Cooked tomatoes for lycopene, a prostate protective antioxidant. Leafy greens and cruciferous vegetables, broccoli, kale, cabbage reduce inflammation. Fatty fish like salmon or sardines rich in omega-3s support hormone balance. Pumpkin seeds and Brazil nuts, high in zinc and selenium, key for prostate health. Green tea boosts circulation and calms inflammation. Even small shifts here make a big difference. Now, supplements. A few have decent research behind them. Here's what's worth considering. Saw palmetto may reduce BPH symptoms and improve flow. Beta-cytosterol, found in many prostate formulas, shown to ease urgency. Zinc and selenium, key for hormone regulation and immune defense. Pygeum, African plum bark, may improve urine flow and reduce inflammation. Pumpkin seed oil supports bladder function. But don't go overboard. These work best with good habits, not instead of them. And finally, daily habits that prevent recurrence. Stay active. Even a 20-minute walk improves circulation, hormone levels, and inflammation. Keep your pelvic floor strong. Yes, Kegels. They're not just for women. Empty your bladder fully. No rushing. No holding it in too long. Drink water throughout the day. Not gallons, but regular, steady sips. This is how you protect your prostate in the long run, naturally. Let me bring you back to Tom, the patient I mentioned earlier. Remember, he walked into my office thinking he was just getting older. Waking up at night, weak stream, always tired. No pain, no fever. Just typical aging, right? But under the surface, that hidden infection was chipping away at his health. We caught it early, treated it properly, and more importantly, Tom changed his habits. He started eating for his prostate, walking every day, doing pelvic floor exercises, taking targeted supplements that actually support his body, not just mask the symptoms. And now, he sleeps through the night, has more energy, even said his bathroom schedule isn't running his day anymore. Tom didn't need a miracle. He needed a blueprint. And that's exactly what I want to give you next. If you want to know what foods reduce prostate inflammation, which supplements actually work and which are just hype, and the daily habits that keep you sleeping, not peeing through the night, then I've got more videos lined up that'll walk you through it, step by step. Tap like if you learned something new and hit subscribe so you don't miss the next video. Your health deserves it.